exciting for me to be here, and I do have to tell this story because I think it's a fantastic one and it's a great lesson. How many of you know Doe Mayer, right, at the university? 10 years ago, I met her wanting desperately to get a job that she had to offer, and she didn't give it to me. And it was working on this fantastic film project with women, I think in East Africa or something like that, and I really, really, really wanted the job. I had just gotten my master's in public health, wanted the job. She told me, she called me, she was very, very kind, very polite, very genuine. She said, I would have loved to hire you, you were fantastic, but we just happened to find somebody who had more qualifications than you do. So I actually met up again with Doe Mayer about a month and a half ago, and I thanked her because if she did give me that job, I would not be a filmmaker. So I just want to tell that story. Okay, so my name is Lisa Russell, and I do work as a filmmaker, but I didn't go to film school, and I didn't take a typical filmmaker's route. I actually started my career getting my master's in public health from Boston University, and I landed my first job working in the war zone in Kosovo and Albania. And it was a great job. I was helping to develop programs for women and children in the refugee camps. I absolutely loved my job. I don't know how quite to describe the feeling it is of being able to work on the front line of an international crisis and day to day really just absorb what's going on. It was a great, incredible experience for me. But something else happened there that really put the idea of storytelling in my head, and that was I had been asked to escort Kitty Dukakis to Albania, and we were invited to a big meeting at the U.S. Embassy, and it was to invite women who were running these programs in the refugee camps to come and talk about the work that they were doing. And there were two women in the room that looked really upset to be there. When we went around the room, they said, you know, we love the work that we're doing, but we're really upset with the journalists who are coming into the refugee camps. And they said they're coming into the camps and they really want to tell this story. And it was a story about how rape was being used as a tool of war. There were a lot of women in the Balkans who were raped as a tool of war. And they said, but they're coming in and they're saying, basically, we have 3 days to tell this story. We need to speak to women who've been raped. Can you raise your hand if you've been raped? And they said, not only is this disrespecting what our people are going through, but they said something that really stuck with me. And they said, what we fear is that at the end of this war, we will no longer be remembered as Kosovar women, but as Kosovar women who've been raped. And that was really, it really impacted me. And this was in 1999 I was there, and so this is before 9/11. This is when we used to have like world news in a minute, and we had flashes of international news, and everything that I looked at, whether it was the HIV/AIDS crisis, whether it was conflict in the Balkans, it was telling stories that I feel were not accurate, at least not authentic to the experiences I was having. Like the war that I was in and experiencing and working in looked nothing like what I was seeing on television. And so I started really observing a lot of the creative content that was coming out. So the documentaries, the PSAs, all these different, films or whatnot, and I just felt that they kept perpetuating this sort of exploitative storytelling, flies in the eyes, poor kids in Africa, like really, horrific, tragic, everything was tragic. Nobody knew anything else besides Africa except the war and the HIV/AIDS epidemic and all of that. And so I decided to pursue learning learning how to be a filmmaker. And I didn't go to film school, but I really think about 3 years to really learn how to make films, how to edit films. And so now I work as a one-person crew. I get hired by UN NGO agencies to go all over the world, which is fantastic. I direct, I produce, I shoot, and I edit my own films. And I use my films in a very different way. Like when I first started my career even, I felt that I wasn't even really looked at as a real filmmaker because I was making more advocacy-related films. I was making more PSAs, more films that weren't film festival type films. They were used more to raise money, to influence policy, to get people aware of certain issues. But at the same time that I was making these films and I was going around around the world, which I loved, I was also getting questions about the ethics of the types of films that I was making. And I would have my friends from Tanzania, for example, my artist friends from Tanzania say, when you come here, we love that you want to come here and learn about our country, but why is it when you come to Tanzania, you only show the bad parts of Tanzania? And I was like, well, I hear you, but I work for the UN, I work for NGOs, and so I tell global health stories. So how can I tell global health stories without showing the difficult parts that people are going through? So how can I tell a story about obstetric fistula, which is a topic that I did a lot of films on? How can I tell that story without showing women suffering from this childbearing injury? Or how can I tell a story about, young people affected by war without talking about the impact of war and the massacres that were occurring to their families? So I really struggled. There were several times where I was like, I can't handle the conflict inside my mind of like whether or not I'm doing the right work and whether or not, Americans should be making these films, and are we making them responsibly, and why is it that even though I've never gone to film school, I don't have any guidelines or certificate that I need to go out and tell really important stories about really intimate topics about people who I don't know. So in 2010, I got asked to speak at this conference. It's now called the Social Good Summit. It's run by the UN Foundation, and they asked me to sit on a panel called The Power of Film. And I know that the reason why they chose me and the woman that I spoke with, who runs this great organization called Film Aid International, and I think she actually has connections to LA, I forget, but is that they wanted us to talk about how powerful film is in the global health and development world and how much it helps to raise awareness and do all the great things that we know it can do. But I started asking questions about, if film is powerful, and we know film is powerful, who has the right to be telling these stories? Do I, as an American, quarter Chinese, Mongolian, Scottish, Irish woman, have the credibility to tell a story about women in Africa? On the flip side, would a filmmaker from South Africa, who's never left South Africa, be able to tell the story about women in the Congo, for example, in the same way that I might be able to because I have traveled extensively and done a lot of work? Does my audience make a difference? Does the fact that my films could actually raise money and awareness and support for people suffering from certain topics if I make a good film and I do well with my films? So I posed those questions, and it was interesting kind of talk amongst global development people. But in general, I just did not want to be the sort of filmmaker or journalist that's like the journalists in Kosovo who are coming in and really telling really personal, tragic stories. What some in our world call poverty porn, if you've heard this term, they call it poverty porn. I didn't want to be that type of filmmaker, and I laugh, but there's like a Saturday Night Live joke skit about 39 cents and humanitarian and Sally Struthers and all of that. So I never wanted my work to be seen as that, but I was having a hard time figuring out how to ethically do it right. So I did a lot of kind of research and thinking and reflecting, and what I really came to terms with is that I had to accept that there is a complete imbalance of power between myself as a filmmaker and the person that I am telling a story about. And in some cases, I'm going into places where my camera equipment alone will cover the cost of HIV/AIDS treatment for somebody dying in Malawi. And that was a real story. I really had that experience. And so understanding that, I think, is necessary to delve further into the ethics of this type of storytelling. And the other thing that I think is interesting about this type of filmmaking, unlike traditional documentaries that have feedback mechanisms, like you can gauge how well a documentary does by press reviews or box office numbers or ratings on Rotten Tomatoes. The type of films I make have no feedback mechanisms, none. So if those of you who know this film, Kony 2012, it was very controversial. It went viral, and people were like, oh, it's a successful film. Well, people who are working on the ground and people who are, from the African continent wouldn't say so. But we wouldn't have any way to say that it was successful or not because there's no feedback mechanisms. And one of the reasons why we don't have feedback mechanisms is because we work in the humanitarian community, and so there's this idea that those of us who work in this world are doing it with good intentions, and therefore why should we be critiquing our work if we're there to do good work, but good intentions don't always translate into responsible actions. And what I would love to see, which doesn't exist, is there is no conference on responsible storytelling. There is no big, there's more interest in it. Storytelling is becoming like a bigger thing in the global health world, but there is no formal blueprint. There's no gatherings, there's no conversations. It's just now kind of, we're, scratching the top. So another resource I found that I thought was really interesting was this Charter for Storytelling Rights that was developed by a center in Australia. And it's interesting, it's set up, I'm not going to read it, but it's set up like the UN Charter, and it has 8 articles, and it talks about the rights of people whose stories are being told. And this is really interesting. Like when I make films, there's a consent process. I have to get consent by the people who I'm interviewing or whatnot. Some people are illiterate, so I have to do on-camera consents. Some I have to get written consents. But do we really think thoroughly in terms of the rights of the people whose stories we're telling? And I thought this was an interesting resource to kind of just look through. So I'm just gonna quickly go through it. One of my favorite lines is the Article 4 when it says, the person is not the problem is the problem. And I'll lead into that later on. But I find it very, very interesting. Okay, so before I show a clip of the film that I'm Heroines of Health, which is about women in global health, I just want to talk about sort of my personal approach to my work and sort of the priorities and the themes that I try to address when I think about doing my projects or when I'm in the edit and I'm thinking about how am I going to tell this story. One of the things that I constantly try to do is break stereotypes. So if there is a stereotype in it, even if I shoot it, if I shoot kids with flies in their eyes, I'm not going to put that in the film. I'm just not going to do it. And I know what the stereotypes are, again, because I've been working in this world for a long time. And I don't like the stereotypes because I feel like they're inaccurate, and I feel like we have enough stories that perpetuate those stereotypes. So let's tell ones that break the stereotypes. The other thing is that a lot of the films I make, a lot of films in my world kind of obsess with like tragedy and trauma. So they lead, if you watch a global health documentary, the first frame might be, somebody in a stressed out, horrible, horrific situation. And that's what you lead with. So your first perception of maybe a character in a film or a situation in the country is going to be trauma. And that's not, as we all know, accurate across the board. Just a quick story, I did a film for PBS called We Will Not Die Like Dogs. And it was a film about 4 AIDS activists who are fighting on the front lines of the AIDS epidemic in their own countries. So this was meant to, again, break the stereotype that Americans and Westerners were the ones solving Africa's AIDS problem by putting a spotlight on 4 incredible activists in 4 different countries. And it was really exciting. It was like my first PBS film. It was an hour-long film. And we had Spike Lee's editor come on board to edit it. And I was like, this is great. Like, I'm getting into the real film world, and I'm going to have credibility with this. But this editor was obsessed with telling the story, starting with a doctor treating a woman who was dying of AIDS, and she was very thin and frail. And I said, we're not starting the film with this image. And she said, well, this is the strongest image to start this film. I said, yes, but everybody who's making this film doesn't want to make that film. And so it created this whole dramatic thing where she brought in her people and this and whatever, and we eventually had to fire her. And it was a weird, it was just career-wise, it was like weird, like why can't I work with somebody who's such an incredible editor, but it's like you're perpetuating the things that we're trying not to show. I also think it's important to find common values to build connection with people. We can all say pretty, confidently that people around the world care about certain common things, like their family or their children, or they want to live a dignified life. So showing that allows us to break down sort of our barriers and kind of get to know and relate to people. To promote empathy, not pity, and they're different. To not tell the entire story up front. There's numerous documentaries that will start off with some text late that basically tells the entire story up front, so it's sort of like, well, why I'm losing interest in watching it. As a filmmaker who understands the craft of filmmaking, keeping audiences intrigued by creating a story structure that keeps people, moving along with the story instead of telling flat stories. And then the last thing I would say is that sometimes our world, or the global health world, is focused on tragedy and loss and trauma and what's not working. But just as powerful, I feel, is inspiration. So if your focus of your film or your story is on somebody who's overcome tremendous barriers and obstacles, then you're inspired and moved by this person, not because of the horrific environment that they're in, but because of the ability to overcome those obstacles and do the great work that they do. So with that said, I'm going to show you pieces of my newest film. It's called Heroines of Health. Heroines of Health profiles 3 women from India, Indonesia, and Kenya who are sort of working on the front lines of healthcare in their communities. It was executive produced by GE Healthcare. They decided they wanted to tell the story to, again, help raise awareness about women working in global health. But I'm not going to show the entire 30-minute film here. You can see it online. It's online. You can Google it. But what I'm going to do is I'm going to show you clips of my film backwards to illustrate some points that I want to show you. So give me a second. I may need your help. No. Your help, maybe? I don't know where here it is. Okay. Okay. So I'm going to show you a clip from a storyline of the woman in Kenya. And it's only like a few minutes long, but I'm just going to start with showing you.
Saya bangga sekali bisa menyelamatkan orang.
It's the thing, the child is coming, yeah, that's what I'm feeling, and that's also scary, because I know she's going through so much pain, and I hope this is going to help. It was a bit hard for me, particularly for me, because we experienced and we saw a child, 1 year, 9 months old girl, who had gotten banned, and the reason she got banned was because they were playing with the sibling, but then an older sibling pushed her, and she dropped inside a boiling pot, and she got banned from waist downwards. So when we were there in the morning with the clinical staff doing their rounds, they were cleaning the bath, and that was so hard. Because I was trying to imagine my own child going through that. And my children are much older than that little girl. So next time, jaribu sana. Kitu kama hii sifanyike tena. Usiwache wanacheza peke yao kama kuna moto karibu. Yeah, I'm telling her when she goes back home, she should make sure this doesn't happen again. By keeping all the children away from the fire. Yeah, they should always play away from the fire, because this is so much pain for the child, and this should never happen to any child, any other child, even this one. It should never happen again. Yeah. Bringing a life into the society, you always want to protect that life. You always dream to support that life and to see how they're going to end up, and also so that they can fulfill their purpose, their reason for being. So that situation where children were dying and they were not counted, nobody knew, nobody reported, that for me was the point that everything changed. Because it is not normal for a mother to lose a child. it is not normal. It has never been normal. It will never be normal.
Okay, so that was not the first clip, but in many global health documentaries, that could have been the first clip. And I feel that if you saw this first in the documentary, actually, I'll just ask you guys, like, what are some of the stereotypes you might have gravitated towards if you saw this first? Anybody? Yes?
The dying African child.
The dying African child, right? Anybody else? Yes?
Poverty.
Poverty, right?
Incompetent mother.
What's that?
Incompetent parent.
Incompetent mother, yes. Great. Yes?
And you just inherently have pity instead of like empathy, because you have been like, introduced to it.
What's that?
You have pity instead of empathy.
Right. You have pity. So now this section comes later on in the film. I could have focused on how many children in Kenya, in Luala, fall into pots and burning things and statistics and all of that. But I felt that she relayed some stuff that, again, has universal appeal to most people. And again, like just a couple people, anything that you feel like she said that makes it universal idea, feeling, whatnot. Yeah.
Children dying is not normal.
Children dying is not normal. Right. What about our own kids? Anybody, did you catch that? That she, she's thinking about her child while she's watching this. So yeah, I won't go too far into that. I'm going to show you the second to last part of the same woman's story. Okay, now this is the section that introduces her work.
Lumayan kalau membantu masyarakat, membantu menjaga cuma kader.
My name is Mercy Award. I'm the Community Programs Director at Luala Community Alliance. Right now we are going to visit the hospital. We are going to take a tour at the hospital. Yeah. So this is the MCH clinic. We are having a few mothers who just had their babies and they are here for immunization. In 2012 we started a program that supported particularly pregnant women and also children. Because previously in this community, people never used to come to the hospital for delivery or even for immunization or bringing their children whenever they were sick. So because of that and because many children used to die, we started a program. We called it Safe Babies then because it was targeting pregnant women throughout their continuum of care. But then we again realized that once the children are fully immunized at 9 months, then they were still susceptible to other common childhood illnesses. So I did Malaria is one of the main killers. So in the program, we decided to train the community healthcare workers to provide community case management for malaria.
from now we are testing malaria management in the community level. So we want to test them if we can find when they are having malaria in the household level. Yeah.
So they identify children who have signs and symptoms of malaria. They test them with the rapid diagnostic test kits and then give them treatment. By the time I was coming to the organization, children were never counted and their deaths did not matter so much because there were so many children died. And the community were at that point where they felt eulogizing all the kids who died is just too many for them. So when we came with the program, we decided to make the community know that the children matter, their lives are important, they are named when they are born, and their deaths matter. So through the enrollment into the program, we have been able to save so many lives, because of the work of the community health workers and also the hospital staff here. They are working day and night to make sure every child sees their 5th birthday. And I'm proud to say, at this point, so many children from this community are over 5 years, compared to the way it used to be before.
Okay, so that was the section where Marcy's introducing her work. And a lot of people kind of smile or laugh a little bit with the 2 boys who obviously did not want to smile after they got poked in the finger. But when I talk about that section, she's actually talking about something very, very serious, and that's the number of children that were dying in this community. They were dying at such a rapid pace that they actually never gave them memorials, they never gave them funerals, they never counted the deaths. There were just so many children dying in this community. And so, if I wanted to, I could have showed different images to cover that section. So what are some ideas of images I could have used for that section when she's talking about children who are dying?
Sick children.
Sick children, yep. What else?
Maybe like burial sites.
Burial sites, exactly.
Grieving mothers.
Grieving mother, crying. So again, a really tragic, sad, dramatic situation. Okay, I'm gonna move forward from it. I'm just trying to go back to when I talked about changing the narrative, the different ways that I feel like you can still cover important global health topics, but maybe shift the focus of what the story is on. So now I'm going to introduce you to the intro of Marcy's story. And just out of curiosity, is there anybody who has ideas of what kind of a person she is or what she might talk about when she's talking about, when she introduces herself? Anybody? She seemed like a caring person, genuine. Yeah. She loves her family, loves her kids, respects herself, loves her job, kind of stuff, universal themes. So I'll just show again just the intro to her section.
My dream had always been to work more closely with women, to help them achieve their dreams, and Lola provided me with that opportunity. In the beginning, when I came, it was a bit hard for me because my family was in Kisumu, and then relocating to this place, it's a very low resource setting. So it was a bit difficult to figure out how things were going to be. I have a husband and 2 children. Ethan is 3 and Maya is 6. Both of them live with the dad because around here it was a bit difficult to find good schools for them. So we talked about it and my husband agreed to take care of them in Kisumu. So I work Monday to Friday, but then over the weekends I travel to Kisumu, which is 2.5 hours away from here. So I go to Kisumu every weekend and then I return on Monday. Yes.
Okay, so again, trying to show, you know, people as people first before people as a problem. I thought it was really interesting when she told me that her husband takes care of the children. When she said that in my interview, I was a little bit like myself even, like, wow, okay. But this is a reality for a lot of women working in global health leadership. And I've had many conversations about how it doesn't seem like even a student that I know who's from LA, who's at Johns Hopkins, her husband is here with her kids, and she gets a lot of interesting questions about, well, how can you leave your kids and go to school? How can you do whatever? But if it were reversed, if it was her husband who was leaving her with her children, there wouldn't be as much of a conversation. So, you know, women working in global health face these sort of challenges. So there's a whole shift that I'm going to take place right now. And before I do that, I just want to say you can watch this entire film. It's 30 minutes. It's online. You can watch it. It's Heroines of Health. But before I go on, is there any questions about just this film or what I showed you right now? Is there any questions geared towards that? Anybody? No? Okay, no problem. All right. So, again, in thinking about storytelling in global health and narratives that are about in global health, one of the things that I started to realize is that different sectors tell stories differently. And I felt like looking to other sectors could provide inspiration or ideas or whatnot to help me come up with different ways of telling stories. And two of the sectors that I thought were interesting were the tech and innovation industry, which focuses a lot on the solutions versus the problems. So there is this very interesting innovation that took place by a Harvard engineering student, and it is a soccer ball that was developed that when kids play with it, for example, it stores kinetic energy, and then at night it can be turned into a lamp. And this is an actual huge innovation in the global health community because we know so many places where lack of electricity impacts the education of children and young people because they can't see to do homework at night, but they will play soccer for 10 hours a day. So this was an interesting way to kind of, you know, store energy, do that, and I wish I remembered the name of the soccer ball, but if you look at any promotional things for them, any documentaries, it's really focused on, look at how great this innovation is in solving this problem, versus look at how bad Sierra Leone is because their electricity is not working. And then in my sort of circle, both socially and just in New York City, I'm around a lot of socially conscious artists, and they provide a lot of inspiration for me in doing my work. People often ask me, like, who inspires you as a filmmaker? And I'm like, to be perfectly honest, like, I'm not around filmmakers or film too much. I go to poetry slams. Like, I work with young poets, and they've given me a lot of inspiration in terms of telling stories or whatnot. And what I realized about these conscious artists, whether they're hip-hop artists or just artists who have a message, you know, cultural diplomats and kind of those kind of folks, is that they shift the narrative to not focus so much on charity to provoke pity, right? But they shift it to more of a justice kind of narrative to promote empowerment. And I thought that was really interesting. So I created a network of conscious artists in New York City where we do performances, we do workshops, and we've done some really innovative stuff. So we've had poets perform in front of the UN Secretary General. This was a beatboxing battle for girls' education, and we're really taking different art forms and using them to translate very dense global health UN documents into more digestible content for a wider audience. And so in that sense, I feel like artists can be the perfect partners for global health and development institutions because the UN, for example, has access and resources, and the artists have credibility and influence sort of at the community level. And so if those relationships can work out, I think it's a fantastic partnership. And that's actually why I was really excited to be here, because I think there's both film students in here and global health students in here. And I would love for you guys to meet each other. I'm not going to call anybody out, but so yes, so this is I Saw the Shadow. Another interesting thing is that at the UN, there's this thing called the Sustainable Development Goals, or global goals, if you've heard of them. And it is the next agenda that's being set by the UN and world leaders for the next 15 years. And I had the honor of going and attending some of these meetings where they were writing this outcome document and really trying to get kind of arts and creativity and storytelling in this important document. But there was only myself and a radio host in these meetings, and we didn't get anywhere. And so I did a word count of the long UN document, like they like to do. And out of 15,868 words, arts and artists is never mentioned, and creativity is only mentioned twice. So there's a lot of obstacles, a lot of work to do to build institutional credibility, but I think having partnerships, even at this level, I think can help perpetuate that. So why artists? I've done a lot of research on stuff because as a filmmaker and as somebody who works in the artist space, you're constantly having to quantify the impact of your work. But as somebody said to me, how can you quantify the impact of a painting? How can you quantify the impact of some of this stuff? But what's interesting is that if you do a little bit of research, it looks like the creative community is going to play a big part in the next global economy, because with all this automation and machine learning or whatnot, the industry you can't really automate is creativity and arts. And so according to the ILO, there's so many millions of workers in the creative class. There's a great book called The Rise of the Creative Class, if you want to read about this, by Richard Florida. It's saying that talented and creative people are to the modern business what access to coal and iron ore was to steelmaking. And the creative class is very diverse, which is interesting. There are, I feel, different types of art and artists. Sometimes when I say artists at the UN, they're like, oh, you should talk to Forrest Whitaker, you should talk to Pharrell. Okay, great, but there's a whole huge community of working filmmakers who are entrepreneurs, mentors, teaching artists and whatnot, who have more time and more ability to invest in a partnership. I think there's high art, there's street art, and there's people who like doing arts and crafts for more of a recreational. But what is wonderful about artists, and here's a singer that we curated for a high-level UN thing, is that we're basically allowed to be everything we're told the UN is not supposed to be. So the UN has to be very diplomatic, you have to be neutral, you can't call out member states, there are very strict rules in working in that environment. But as partners, we can create work that is more emotional or visionary or popular or bold. And that's an important element when you're telling really dynamic stories coming out of the global health and development community. Sorry. So I'm going to show you one other film. It's short. It's only 2.5 minutes long. But I do a lot of work with young poets in New York City. And this is an example of two creative people coming together. We didn't have funding for this. Nobody supported it. We just said, he wrote this incredible poem about climate change. I was like, let's do a video together. So we got together and made this short film.
Somewhere close, a woman's hands are shaking like a tantrum under California's feet. I can feel the sea level beneath her eyes rising like temperature. This warm body of water sitting on the edge of her sight, still as the calm after a flood falls like an empire. Tears running down her cheek like wildlife out of a burning habitat, her lungs, two volcanoes sleeping under a blanket of smoke, screaming in a voice made of ashes hot enough to peel the skin off the sky, fingers running through her scalp like chainsaws through a forest, she's stressed out. Gray as a rain cloud and a hurricane, there's a landfill-sized hole buried in the layers of her heart. I can smell the methane walking out of her pores. Like an alcoholic walks into the living room, body covered in bruises only a man made. She cries every day. And if you ask her how to make her stop. She'll tell you. Ride a bike with me. Hold my hand with the lights off. Pick those poems up off the floor. Don't throw them away. Finish them. Use them over and over and over, and stop moving so fast. You're gonna miss everything I made for us. Don't take me for granted. Treat me like you would treat your mother. Like I'm the only one you'll ever have.
Okay, so I wanted to show that for a couple reasons. One is that, again, like working with artists are really they're able to translate kind of dense material. Like when young people, especially that I work with, are like, we can't even follow the climate change thing because it's so like numbers and, you know, statistics and all of this, but to be able to humanize it or to put, you know, translate it into something more digestible is important. But I also wanted to show this because I feel like there are people who want to do creative projects, but they feel that they're intimidated by it, or that they don't have the money, or they need to get this camera and this too. We did this film by recording the audio and shooting his performance in my kitchen with a green screen. And then I spent $72 on the music and the archival footage and put it together, and I edit and I do everything, so it was easy. But it got into like 30 film festivals, like environmental film festivals, social change festivals. But bigger than that, we were able to use this in very, you know, policy-driven areas. So we screened this for a UN Department of Public Information climate change event. And they showed it, and I got to make closing remarks, which was great. Then we showed it for International Youth Day, and it was the first time that a young artist was able to do official remarks, and it was a really interesting way to, you know, again, put these two worlds together. We also we did win one festival, San Francisco Green Fest, so we won $300, we actually made money, which is fun. But I just wanted to say that you don't need a lot to do something. And I feel that if you're a global health student and you have creative impulses, that there are ways that you can do little things, short videos or whatnot. You can collaborate with film students here to do something that doesn't require a lot of you know, travel or production skills or whatnot. This is a very simple project. Okay. Okay, so I'm going to wrap up by just introducing you to one last thing, and that is a new project of mine. I remember when I told you earlier that there are no feedback mechanisms for the kind of films that I make. Well, I got an email last year, and it said, "Congratulations, you've been nominated to do a TED Talk for Johnson & Johnson." And I was like, yes, this is like career, like bucket list, I want to do a TED Talk. And Johnson & Johnson does great work. I mean, they support a lot of global health initiatives. They do a lot of stuff around women and girls. I'm like, this is fantastic. It's got to be about filmmaking or girls' empowerment or something. And I open it up and they say, the theme for this year's TEDx Johnson & Johnson conference is big data. And I was like, why would somebody nominate me for big data? But I'm like, I want to do the talk. So I researched everything about big data and creativity, big data and filmmaking, and what kept popping up was Netflix. And Netflix uses big data to make creative decisions about their programming. Like they know your gender, they know how many times you've logged on, they know what programs you like, their algorithm helps make recommendations for other programs. And so apparently when House of Cards was being shopped around, Netflix analyzed their viewer habits and they said, okay, anything that has Kevin Spacey, tends to do well. Anything directed by David Fincher tends to do well. Anything that's a political drama tends to do well. We're so convinced this is the perfect program for our audience, we're not just going to pilot it, we're going to drop $2 million and produce all 2 seasons all at once. And we all know how successful House of Cards was. So my thought was if big data could help Netflix revolutionize their creative decisions about their programming, maybe we could use big data to revolutionize how we tell global health stories. And so I came up with this talk and this idea, and everyone's like, this is great, you should do this, you should launch it. I'm like, of course, because now I need to become a startup person. Okay. So I came up with this concept, which was creating an entertainment platform for the social good that would house creative content around global health and humanitarian issues. So there would be music, films, poetry, or whatnot. And behind the scenes, on the back end, it would be collecting data on what type of users and what audiences would gravitate towards which content. So when we talk about a PSA that's or a short film that's promoting girls' education in Tanzania, but we notice that girls in Tanzania are not watching this, then maybe we need to start reevaluating how we're telling that story. And for me, I feel like it would create a guideline or at least be able to start conversations using data to say, okay, are these kind of, is this content relevant? Is it effective? In addition to the content, there would also be action steps. So using Mother's Cry, for example, there would be action steps. So at the end of watching the content, you could donate, you can share, you can sign a petition, you can support a brand. If you wanted to donate, you can, of course, support the artist, because artists don't always get the support a nonprofit, support a brand, and we would evaluate also what types of content inspires people to do different actions, and we would create, hopefully, reports or some sort of blueprint of what type of content is really effective. And so that's sort of my concept for this. I'm having the prototype built and it's going to launch in April. So if any of you either have content that you want to submit, I'm collecting submissions for content. If you want to support it and just see what happens, you can follow us. I have a demo site, a beta site. And I think that's all I'm going to say about everything before we open the floor up. But